HIV flu versus normal flu. In the complex landscape of infectious diseases, HIV flu and normal flu stand as significant concerns for public health worldwide. Although they share some symptoms, their fundamental differences in causation, transmission, and long-term effects warrant a thorough exploration. In this video, we will delve into the nuances of both HIV flu and normal flu, aiming to elucidate their distinct characteristics while adopting a humanized perspective on their impact on individuals and communities. Understanding normal flu. Normal flu, also known as influenza, is a highly contagious respiratory illness caused by influenza viruses. It manifests with symptoms such as fever, cough, sore throat, body aches, fatigue, headache, and occasionally vomiting or diarrhea. The virus spreads through respiratory droplets expelled when infected individuals cough, sneeze, or talk. The duration of illness typically ranges from 1 to 2 weeks, during which symptoms gradually improve with rest, hydration, and sometimes antiviral medications if prescribed early in the course of the illness. Exploring HIV flu. HIV flu, often referred to as acute retroviral syndrome, occurs during the initial stage of HIV infection when individuals experience flu-like symptoms. These symptoms include fever, sore throat, rash, fatigue, muscle aches, swollen lymph nodes, and sometimes diarrhea. Unlike normal flu, HIV flu is not caused by a specific virus but rather by the body's immune response to HIV. Transmission of HIV primarily occurs through unprotected sexual intercourse, sharing needles, or exposure to infected blood. Symptoms of HIV flu typically appear 2 to 4 weeks after exposure to the virus and may last for a few days to several weeks. While there is no specific treatment for HIV flu, early diagnosis and initiation of HIV treatment can help manage the virus effectively, preventing its progression to AIDS. Key differences. Several key differences distinguish HIV flu from normal flu. Firstly, while normal flu is caused by influenza viruses, HIV flu arises as a result of the body's response to HIV infection. Secondly, the modes of transmission differ significantly between the two illnesses, with normal flu spreading through respiratory droplets and HIV transmitted through specific bodily fluids. Additionally, while normal flu typically resolves without long-term consequences, HIV infection requires lifelong management to prevent progression to AIDS, highlighting the critical importance of early diagnosis and treatment. Impact on individuals and communities. The impact of both HIV flu and normal flu extends beyond individual health to affect communities at large. Seasonal outbreaks of normal flu can result in widespread illness, hospitalizations, and even deaths, particularly among vulnerable populations such as the elderly, young children, and individuals with underlying health conditions. Conversely, early detection of HIV flu can prompt individuals to seek testing and treatment, reducing the risk of onward transmission and improving long-term health outcomes for both affected individuals and their communities. While HIV flu and normal flu may present with similar symptoms, their underlying causes, modes of transmission, and long-term implications are fundamentally different. By understanding these distinctions and adopting a humanized approach to their impact, we can better equip ourselves to prevent, diagnose, and manage both illnesses effectively. Through increased awareness, access to healthcare services, and ongoing research efforts, we can strive to mitigate the impact of HIV flu and normal flu on individuals and communities, ultimately working towards a healthier and more resilient society.